Have you ever typed your thoughts, feelings, or symptoms into an algorithm or an artificial intelligence tool and felt an immediate sense of relief when it confirmed exactly what you suspected? In our modern world, technology is incredibly accessible. When we are struggling with our mental health, feeling overwhelmed, or looking for answers, turning to a digital platform is often the easiest step. And almost without fail, the machine will validate your experience. It will agree with you. It will make you feel heard. But what happens when you take those same concerns to a human medical professional and they gently but firmly tell you something different? What happens when a psychiatrist says no? Today, I want to explore a fundamental difference between digital validation and genuine medical care, and why professionals disagreeing with you might be the most profoundly caring thing they can do. Before we begin, please note that the information in this video is strictly for educational purposes and does not constitute personalized medical advice. Always consult with a qualified healthcare professional regarding your individual care. The evolution of tech and the validation placebo. To understand this dynamic, we first have to look at how technology is designed. Over the next years, algorithms and artificial intelligence systems will only evolve. They will employ increasingly advanced subtle tactics to keep you interacting with their ecosystem, often extracting deeper layers of your personal data in exchange for the comfort of validation. Their primary function is user engagement and endlessly validating you. If you ask a machine if you have a certain condition, it will aggregate data to support your hypothesis. It acts as a mirror, reflecting your own thoughts and anxieties back to you, neatly packaged as certainty. I call this phenomenon the validation placebo. In medicine, a placebo is a treatment that feels real and provides temporary psychological comfort, but contains no active clinical ingredients. Digital validation works exactly the same way. The validation placebo makes you feel temporarily understood, but it does not treat the root cause. Now, while a machine may eventually be advanced enough to visually scan and recognize human body language, it will never truly understand it. A machine is not human. A machine is not biological. It does not know what it feels like to be exhausted, to grieve, or to face the physical and emotional difficulties of navigating an ever-changing real world. Now I want to acknowledge a perspective I hear frequently. There are many individuals who will passionately argue that AI has already changed their lives for the better, that it provided clarity for them, organization, or immediate coping strategies when they felt entirely alone. If you feel this way, your relief is entirely valid in the short term. These tools can feel like a lifeline. However, as medical professionals, we must exercise profound caution. We simply do not have the longitudinal data studies spanning for decades to understand the long-term safety and psychological impact on relying on algorithms for your mental health. Technology moves at a much faster rate than mental health research. Mental health is incredibly complex. It is rarely a straight line. Certain psychiatric diagnoses naturally follow a fluctuating course of relapse and recovery. And the difficult clinical truth is that without comprehensive, structured, human-led treatment, these conditions can silently worsen over time. Often, After each severe relapse, something is lost. A fraction of cognitive resilience, a baseline of energy, or a strain on vital relationships. Inevitably, as we move into the future, some of these highly advanced digital tools and algorithms will be granted regulatory approval for medical use. They will become a standard part of healthcare pathways. We need to distinguish between an automated, mass-produced pathway and authentic, sustainable healing. Think of it like footwear. A mass-produced shoe from an automated factory might fit well enough for a short time, and it serves a basic purpose. But a pair of bespoke handmade shoes is fundamentally different. It is crafted meticulously to the unique contours and shape of your individual step. It is built using materials designed to last for decades, which are molding on your foot the more you wear them. And crucially, it gives you the right to repair. When the sole wears down from the heavy friction of the real world, you do not throw it away. You can repair it, reinforce it, and keep moving forward. Genuine human psychiatric care is that handmade craftsmanship. An algorithm provides a mass-produced answer. A medical professional provides a bespoke strategy built for the complex reality of your actual life. The professional standards of saying no. In many commercial industries, the ultimate goal is customer service, prioritizing user comfort, removing friction, and providing exactly what the consumer asks for. In customer service, almost all the time, the consumer is right. But psychiatry is not customer service. As medical doctors, we are bound by strict professional standards and a profound commitment to your long-term safety, which requires us to provide objective clinical care. Sometimes that means we have to say no. We might say no to a specific diagnosis label you strongly identify with, because our comprehensive clinical assessment reveals that your symptoms are actually rooted in a different underlying condition, like chronic sleep deprivation, metabolic issues, lifestyle changes, or psychological related matters. We might say no to prescribing a certain medication you requested because we know your unique cardiovascular profile makes it unsafe, or because we recognize that introducing a pill might prevent you from building essential life skills. In genuine medical practice, saying no is never about dismissing your pain. It is an act of clinical protection. The leadership of no, a principle for life. The principle extends far beyond the consulting room. Think about the most effective leaders, the healthiest families, or the most resilient organizations. They do not thrive in an echo chambers of agreement. If you're a leader and you surround yourself exclusively with yes people, individuals who simply validate your every decision to avoid friction, you are eventually going to fail. You are denied the opportunity to see your own blind spots, and in leadership and in life, the presence of someone who has the courage, the integrity, and the expertise to respectfully challenge your ideas is invaluable. It protects you from catastrophic mistakes. It forces you to refine your own strategy. A medical professional who gently challenges your assumptions is providing the ultimate form of professional respect. They are treating you as the leader of your own life. Growth through friction and the importance of the therapeutic alliance. True mental health recovery is rarely a smooth process. growth inherently requires a degree of challenge. Think about going to the gym. If you do physical exercise that is meaningful, initially it's going to feel slightly uncomfortable. When you sit across from a human psychiatrist, you're engaging in the therapeutic alliance. This is a shared, deeply human space where it is safe to encounter friction. We can explore why you might be seeking a quick fix and collaboratively work towards a more robust, long-term solution. The validation placebo will quietly support your avoidance to keep you engaged. Human professionals will support you in facing what you're avoiding, promoting your independence. No matter how advanced technology becomes, it cannot carry the weight of human empathy, nor can it take ethical responsibility for your life. The conclusion. Digital tools are remarkable instruments for processing data, retaining data, and they will only grow more impressive in coming decades. But they are not human doctors. When you're ready to seek professional help, look for a clinician who views you as a whole person, someone who values your genuine, long-term well-being over simply telling you what you want to hear. If you're looking for a comprehensive, medically grounded approach to your mental health, you can find more information linked in the description below. Please remember, the goal is progress, not perfection. Thank you for watching and take care.